I have a history in the family for amyloidosis. My father had it, and 5 of my uncles and 1 of my aunts had it, and 2 great uncles that we think had it. So I was very, excuse me, I was very familiar to what to be looking for.
It took about 8 years to get the diagnosis of amyloidosis, and he saw about 14 doctors before he got his diagnosis.
About 5, well, it took her 5 years to get it diagnosed, right? And then once she got it diagnosed, she knew what it was, right? After that, they had me take the fat pad or get tested for the gene. And at the time, I didn't expect any, because I had no symptoms at all, right? And just think, okay, let's see if I have the gene or not. And lo and behold, not only did I have the gene, they found out it was active in me. And so from there, it's been, it's progressed up to, right now, up to my ankles. So it's something that I have all the time.
When I was diagnosed, I was in heart failure, liver failure, and kidney failure. And I was on dialysis.
So it got to a point where we just got a real soft rug, and I spent many nights, I just slept in the bathroom so I could get 5 or 6 minutes of sleep.
It was kind of, you've been to all these doctors, what are you doing here? And I said, we're kind of looking for a silver bullet. And he said there's no silver bullet.
We need something that will at least, if not a cure, will at least improve our quality of life. Whether it's neuropathy, orthostatic hypotension, whether it's bowel issues, whether it's kidneys, eyes, whatever. But whatever it is, it may be a combination of things, but at least improve the quality of life.
I think that the criteria shouldn't be as rigid as it is in some of these trials, because all patients are different. Every organ is, you don't know what's going on in your body, what organ's getting affected. That's one of the worst things about the disease.
I think I got a placebo because I got worse. I went from walking to walking with a cane to using this.
The transplant I did in 2002 worked very well. There were a lot of risk. My heart was involved heavily. Still, I took the risk of the transplant because otherwise they were giving me 6 months leave, and at 53, that was very hard to accept.
It's so strange conceptually, because it really is a terminal illness at this point that nothing feels risky.
Knowing my history, my family history, that was a no-brainer for me. I'll go on any trial I could possibly can. I know it's not going to help me. I feel I'm beyond that point, but it will help someone else.
I went from a point of really not wanting to be here, and my main thoughts at the time for going into a drug trial was to save my family, not me, to a point of where I feel good. I'm glad I'm alive. My quality of life is 6 times better, and it's exciting to tell them, if you guys approve this, and if it's working, my family won't have to go through this. The second they find out they're starting to manifest, maybe a little diarrhea, they take this drug, they don't have to go through what I went through. You don't have to hit bottom and work your way back. So I'd like to tell them, man, prove this drug, it works, I'm proof.
I know that I am good enough right now, and I can live my life, but I need to get something that's going to prevent this thing from progressing, and time is what is so critical to me.
Having this disease is like standing on a cliff, and you know that the cliff is deteriorated and you're standing close to the edge. And you know that eventually this cliff is going to drop because it's dropped on others before you. You know that wave is coming. And time is running out. Every second, time is running out for us. It's running out for our children, it's running out for our grandchildren. As that clock ticks, we need something, we need a protocol, we need doctors to come together and for them to listen to the specialists in the field on how to better treat this disease. Some kind of format to go than people that have to wait years and years to get diagnosed. We need better education, we need some hope, and if any of those drugs can improve our quality of life, why would you withhold that? Then watch somebody live a hellacious, demise. That's what we need. We need hope.